to think about what happens when we stop ritualizing, to understand why it can be hard sometimes. I think an example I really like is around perfectionism. One thing we know that can happen is if there's a comorbidity like ADHD, and someone had untreated ADHD, where someone has a genuine problem attenuating, organizing themselves, perfectionism can develop as a coping skill to that, as a to compensate for that deficit. And if you start asking someone to pull back from those behaviors, they're losing some structure, some like extra focus that comes from that anxiety of like, don't mess this up. And that you pull back and all of a sudden there's more errors happening. That doesn't feel good either.
Yeah.
So it's about what happens right after I stop ritualizing that matters. Like with depression, okay, I'm not ritualizing, but I still don't have the life I want. It's not like all of a sudden everything's right there waiting for me versus what I know and what can provide relief. Like there's many factors like that. In terms of like other comorbidities, I think we see a lot of trauma history, right? Where there's a difficult learning experience that the brain really doesn't want to have happen again. And so when you're trying to pull back some of the rituals that have sort of developed to get back control of life after trauma, if you haven't addressed the underlying trauma, like that's terrifying, right? So like often we stop OCD treatment or in tandem say we need to start doing some trauma focused exposure work.